الدكتور عادل المطيري.
بسم الله الرحمن الرحيم. Good afternoon. Welcome back. I am privileged to co-chair this panel discussion with my colleague Dr. Adil Al-Mutairi, Director Science and Technology Department, King Abdullah International Medical Research Center. I am also honored to introduce the panelists, Dr. Ali bin Mohammed Al-Hamdan, CEO, Product Evaluation, Saudi FDA. Laboratory for Leidos Biomedical Research at the Frederick National Laboratory for Cancer Center. Mr. Anas Al-Hnehin. He is skilled innovation management. He is a holder of master degree in technology and innovation. I would like to let my co-chair Dr. Adil Al-Mutairi to give brief introduction to the discussion. Dr. Adil.
Bismillah. Thank you, Dr. Ali, for the introduction. Our session today about building biomedical R&D through partnerships. I drafted a few slides adopted from the literature just to pave the way for our discussion today. The key points that will be discussed today are about requirements for a successful partnership. Expected benefits, potential challenge, how to choose the right partner, establishing a partnership with a biotechnology company or academic institution, which one is better, and both can be okay. And then conclude with recommendations. So research and development, as all we know, plays an important critical role in the innovation process. It is essentially an investment in technology and capabilities to produce new knowledge, processes, and relevant services. The innovations are no longer developed in a vacuum. No companies can work by themselves or in isolation from another. They have to partner. So nowadays companies are developing often work with partners to develop innovative strategies and product. All major drug development projects rely on one or more partners to aid and help them to develop their product and accelerate the way to reach the market. Making the right decision in the right time with the right partner for your business promises to streamline clinical R&D practices by improving development time, increasing efficiency and streamline weaker operation areas. A poorly chosen or ill-managed partnership is destined to be a burden on both sponsor and vendor and place a huge strain on resources. So now the big question is, why do we collaborate? Why do we need a collaborator? What are the benefits of having collaboration? So collaboration between biotechnology companies and large pharmaceutical companies has the potential to create benefits and value for both parties. For the small companies, for example, they will be able to access the financial resources of a large company, regulatory experience and infrastructure of the partner, extended development resources to develop emerging products, the sales and marketing capability of a large pharmaceutical company, the credibility and perceived value provided by working with a mature, respected organization. So the potential benefits for the large pharmaceutical company as a result of such collaboration is being supplied with a new product to fill the requirement for a healthy product pipeline, having access to new technology to assist in a drug discovery or development, being expected to a more nimble and innovative and also radical culture. There are 5 tips for creating effective biotechnology partnerships suggested by Dr. James Sabry. He said that every company has to know what to work on before you even start to think about partnerships, and you have to decide which molecule or scientific path to pursue. Plan to partner. Choose the right partner. The reality of our business is that 9 in 10 prospective therapeutics that enter clinical development fail to reach the marketplace. Stay attuned. Every company has to know what the other company has in terms of scientist culture and its business model. Meld science and art. Partnerships have both science and art components. Push the envelope. The best partnerships are not the ones that follow the pack, and instead they are the ones that force the industry to change the way it thinks about developing new therapeutics. Now I'll give the microphone to my colleague, Dr. Ali, to start the discussion with the panel.
Hello. Thanks, Dr. Adil. So as a reminder, for those who did not attend from the beginning, this discussion is about building a strong partnership between medical research and development and biotechnology industry. There are different domains mentioned by Dr. Adil. I just repeat some of them. We are going to talk about the importance and how this partnership could be built, the advantages and challenges, and we will end with recommendations from the panelists and from you as well. So please take note of the discussion, and at the end, for about 15 minutes, we will leave a room for comments and questions. So let me start with this question. What is the understanding of biotechnology industry? Medical research and development have been explained, but we need to have shared understanding of the biotechnology, and this is open for the panelists. Dr. Anas?
I think it's like depends on the understanding of the spectrum of the biomedical company that they are looking for a certain partnership. They have to define in which area that they are looking for to partner. If it is like in the pharmaceutical or like in the biotech in general, or like in medical devices. The definition, the issue that the definition of biotechnology is kind of wide, and before they are like assisting any potential partnership, they have to define the needs and also which gaps that they are looking to be filled. This is my response to your question.
That was a terrific introduction, by the way. It captured a lot of the elements that we face in almost every collaboration. So in biotechnology, you might say, well, what is the incentive to collaborate? And it's as you described. It's because both parties benefit in some way, somehow. I can say that for my laboratory, which provides services, free services, and infrastructure support to investigators in cancer applications, you know, free is a very good price. It's they almost cannot believe it, and so they obviously benefit from the free services and the 14 years of knowledge base that we have working with nanoparticles. What you might ask, well, what does my laboratory benefit from that? Well, I represent the National Cancer Institute, and they invested considerable money in nanomedicine because they saw the potential and the capabilities. And so it's altruistic, if you will, but they're advancing the field forward. So once that understanding is in place, that becomes the basis of the partnership.
Thank you very much. بسم الله الرحمن الرحيم. حياكم الله جميعا. أشكر الزملاء على حسن الاستضافة. I think when it comes to biotechnology industry, the main issue has to be vision and strategy. We have to take a step back and look at the big picture. Are we going in the right direction? We are responsible, of course, at the Saudi Food and Drug Authority of regulation of biotechnology industry. And we have seen several companies not succeed because they have not really chosen the right partner. Maybe they had some kind of issue or lacking good manufacturing practice, or they didn't really have the right clinical study. So I think choosing the right partner is essential for success. In addition to that, several companies are trying to produce locally, and most of them think only to cover the local market. I don't think that's the right vision. I think we should think more globally and try to make Saudi Arabia a hub for biotechnology industry, not just to cover the local requirement, but to be an exporter of biotechnology products. Thank you very much.
Thank you, Dr. Ali. Is the quality of voice good? It's not good from here, but okay. Well, thank you. I'm sure many of you have the same understanding, but generally this overview understanding of biotechnology will help us to proceed further. So the next point, when we plan to build strong partnership, there should be some considerations by different parties. So I want you to comment on this consideration that when we think about building partnership, we have to consider.
I'm glad that you bring this question to the table. The first thing is that they have to, every CEO of any like biotech company, that they ask themselves, do I need this partnership? And what's like I gain, or like what's the clear goal of that partnership that I will have to get after I will have the signature with other like organization or other institutes. Also to define, let's say the milestone that will be came out from that partnership that need to be clear and stated. Also have to be caution with other party to be selected that will be not like affect any other relationship with other institute. Also with other caution with the knowledge transfer or like technology transfer that will be happen. This need to be protected and also secured before any agreement that will be in place. This is my comment.
Thank you, Anas. Dr. McNeil?
For our laboratory, we have all of our capabilities listed on a website, and we go to presentations and show our capabilities and what we can do. Obviously, that's going to be a good match for somebody in development. But I'll say a consideration that both sides have are an issue of trust. We want to make sure on both sides that we can look the person in the eye and say, I can trust this person with my intellectual property, or I, Scott McNeil, can trust this person to contribute to our credibility, especially in public forums, because how we're perceived is very important to submissions to the NCL. And so once we establish that trust, things grow from there. I'll give you some data points in that when we first advertised the capabilities of the laboratory, it was all done by social media and on the web. We had very few submissions, but once we were able to go out and meet the audience and have hallway discussions with them, and again, look one another in the eye and say, hey, I can trust this guy, and that became the basis of the partnership, as intangible as that may sound.
Thank you. Dr. Ali?
Thank you, Doctor. I think a proof of success is important. You don't go in partnership with someone who hasn't already been successful. And again, it's all about increasing the local content. What will be transferred to Saudi Arabia in regards to the product, in regard to some kind of technology, and the decision strategically should be based on that. Thank you very much.
Thank you. Now we know how important to have a partnership, and what kind of benefits that will bring to the small company and also the large pharmaceutical company. But I want you to, if possible, to identify the criteria or the requirements to establish a good and successful and effective partnership.
Thank you so much for this question. I think once you feel that the other party or the other institute that you are looking to have a partnership with that fill the gap or fill the, let's say, the needs that you have, which will be successful and great. Also, try to have, let's say, different partnership in different spectrum. Let's say one with, let's say, academic, one will be to fill the gap in R&D needs. One with, let's say, with a large or larger institute than your size to fill the need or to give you access to the market. And also, if you have, which is, I think is kind of important and fatal, if you have a partnership with a governmental institute, let's say with the regulatory firm that they have it in your country, which is will be established kind of smooth access to the market and also to regulate your product or let's say your services. Thank you.
Dr. Makna?
So when you have a free resource, there's sometimes a long line for that. So we in fact do have entrance criteria where we score collaborations. That's primarily based on the maturity of the concept, which translates into the data and more specifically demonstrated efficacy in a biological system. In general terms, as was alluded to earlier, the match for a partner has to be somewhat obviously mutually beneficial, but in our case we cannot help investigators that are still very early stage, that are still trying to down select their lead item. So in that term, it has to be a good match on both sides, as level, at least from our perspective, and for infrastructure support in terms of maturity. I suspect that also applies to other resources as well, other infrastructure resources, whether those be core laboratories or even incubators.
Thank you. Dr. Ali?
Thank you very much. I think it depends on your strategy and what do you want to achieve. There are two approaches. The first one is if you want to go with the universities and try to come up with your own product. You'll set up the research, the preclinical, then the clinical, then manufacturing, GMP and quality and so on, and then register your own product. But if you want to bring the industry from the outside, the technology from the outside, try to create your own, for example, biotech product or biosimilar or recombinant vaccine. You go to the companies that have already been successful and they have registered their products in certain regulatory authorities and set up partnership with that. So it depends what kind of approach you want to go with.
Thank you. So for any partnership between two or more parties, success is important for all. And one important factor for success is mutual gaining from that partnership. So the question, should a biotechnology company, or why should a biotechnology company make a partnership with academic or research institute versus doing it with another biotechnology company? Open forward.
Glad to have that question. I see in most cases both sides would be great and actually beneficial. However, based on your needs, based of your strategic plan, you could choose which side I have to be partnership with. If I have, let's say, if I'm like a small organization, small biotech company, that if I do my own R&D activities will be kind of expensive. However, if you collaborate with another research institute, especially if they are within your region, will be get a lot of benefits and also will gain a lot of experience. And both parties will be actually happy to continue that partnership. Also, if I am looking for someone like huge organization or bigger organization, that I might get great access to the market, especially if they have a multinational company and they have, let's say, existing branches around the world, and also will be healthy for the other side as well. This is my opinion. Thank you.
Fair enough. Thank you.
That's a great question. Let me rephrase it just slightly. And why should a biotech partner with another biotech and or versus a government-supported or a incubator facility? And the answer that I'll throw out is probably not what you're expecting. It's when things go wrong. If something happens, whether that be lack of funding or an adverse event, everyone's going to look out for their own interests, and that partnership is then at risk. In the case of another biotech, again, that partner is going to look out for their interests, which may or may not overlap with yours. Using a incubator or infrastructure facility, one is as I said earlier, you gain the knowledge base that incubator does. In sense of an incubator, there's resources for business case, for legal, for other aspects. And in my case, there's 14 years of historical data that we can point you in the right direction. So that's something to consider. And surprisingly enough, it comes up. We all, in good faith, enter into a partnership, but probably 1 out of every 20 of them, in our case, something happens. There's a mislabeling of a tube that costs lots of money to analyze, and so that's something to consider as you enter into a partnership.
Thank you.
I think they go hand in hand. You can't really choose one over the other. And if by 2030 our vision is to be an exporter of biotech products, we need first to transfer the knowledge and make sure that our youth, getting out from our universities and colleges, know how to manufacture, know how to manage quality management system, know how to do the calibration for the scientific equipment. Once we can do that, when the technology has been transferred from outside, we have about 10 years or 11 years to do that. So I truly think it's possible, and we have to take a chance. Not all ventures will be successful, as the doctor said, but we have to take a chance. And if our 10 to 20 to 30% successful, I think that will be more than sufficient, inshallah. Thank you.
Thank you. So, how do you see it? How do you see the partnership worldwide, regionally, and within the kingdom? Open.
My personal opinion? I could see I saw a lot of partnership being done here in the kingdom, which is, I didn't think this is a healthy indication. most of it actually agencies is being focused, or they have have a clear milestone. Sometimes it's poorly being managed. But however, if you see the experience from other sides, especially like in the advanced industrial country like United States or like other countries, I think the milestone has been defined, and also it's been like well being managed, and also both sides they have like assigned officer to manage that relationship, which is actually show you the result in very short time, which is my hope actually, and also my recommendation of that experience to be transferred here locally, and the local partnership to be well shaped and well defined before any start of relationship or collaboration between two entities. Thank you.
Thank you. Dr. Makni.
In our case, there's actually strong incentive to establish international partnerships. For cancer research and oncology, cancer is no respecter of borders or tariff agreements or politics or whatever you happen to read in the news. There's a lot to be gained by partnering with international researchers. Case in point, we have a number of submitters to the laboratory from international researchers from North America, meaning Canada, New Mexico, from Asia, from Europe. And then 3 years ago, we established a sister lab of the NCL in the European Union, and that was funded directly by the European Commission. We have more or less seamless operations. We don't have seamless data, but certainly operations. We share know-how, we share knowledge, and we cross-validate one another's data. So I think that there's a strong green light to partner internationally.
Thank you. I think we can have more collaboration that we have as we stand. There are a lot of products, biotech products, going out of patency. For example, Rituxan and Avastin. And there aren't any local manufacturers yet. There are a lot of efforts done by the Saudi FDA, by our colleagues in Saga, by the industrial clusters. And there are some, I think there's Ter Pharma and Saudi Vax, they're trying to manufacture locally biological products. Also there is Arabio. But I think if you want to be international export of this product, we have to start early. We need to have a very good strategy and vision, and we need to work on it for the next 10 years.
Thank you. The success of biotechnology company is through establishing collaboration or partnership. But this is something that not really easy to do. Of course, it has a lot of challenge and the obstacles. I just want to comment about the expected organizational or technical challenge around establishing a partnership.
I only have, like, let's say, one of the most challenging that I could see is I'm wondering if they have, like, let's say, the chemistry between each other. That they understand each other's needs, that they have the same interest. This is the most challenge that I think both party, or let's say the local entity, especially in the biotech, that they face right now. One of the solutions that maybe I could recommend it is start with someone, let's say, within your size. Start with something, let's say, within, like, let's say, within that region. Then start to grow and, let's say, expand your relationship with other partnership outside your region. This is also the thing that I think is supposed to be taken care. Thanks.
Two main areas that pose challenges to us and delays. One of those are the technical challenges of the terms within the agreement. Everything that is submitted is done under confidentiality, but when you're discussing IP, intellectual property, the submitter wants to make sure that their IP is protected. And so agreeing to just slight changes in those terms, meaning what I would view as wordsmithing takes forever because the darn lawyers get involved, not the scientists. The other challenge is human nature is we put up our best front when we interact with people. Well, we do that also as companies. And so there's the facade, if you will, of what we're presenting. And then when the cloak is taken back and it's time to collaborate, issues such as, well, the company told us that they could produce a gram of material in 3 weeks, and in fact, it's going to take them 6 months. Or they said that they conducted a certain assay, but that assay was actually on a different lot with a different batch and a different formulation. And so the technical challenges on the actual data collaboration have to do with things like scale up and producing material.
Thank you. I think a lot has been done to improve the investment environment in Saudi Arabia. There have been a lot of initiatives, and I think that the only thing that we can do is start early. A good example has been South Korea. They have been very successful in producing biotechnology products, and I think they have achieved 2 or 3 years ago, they have registered the first monoclonal antibody in Europe as a biosimilar product. I think it was by the company called Celltrion, and it took them, I think, 6 years to transfer the knowledge from Canada to South Korea. So I think the environment is healthy, it is doable. We just have to start, and again, we have to take a chance, choose the right partner who has an established success record, and tawakkal ala Allah. Thank you very much.
Thank you. I think we have covered the most important objectives of the discussion. Thanks to the panelists. We are left with the recommendations and the strategy. But before we go there, I would like to invite all the audience to ask questions or to give comments, and we'll take it from there. Remember, the discussion is about building strong partnership between biotechnology companies and medical research and development. Yes, please.
Yes, thank you very much for your valuable comments and discussion. From your discussion, I understand that what you mean by partnership is most of the time partnership with a foreign company, with a foreign party. There was no emphasis on partnership with local partners. And this is one point that was not emphasized. The second point.
Sorry, we don't hear very well. Can we adjust the sound?
Yes, the second point is, the types of partnerships. I mean, most of your talk was about technical partnerships. What about financial partnerships? Suppose that I'm a Saudi company who's interested in producing X bioproduct and I don't have enough money. What do you advise in this case? Shall I go for a foreign partner or a local partner? So this is my second point. Can you hear me? No?
Thank you. Sorry, we did not hear you very well, so you can leave the mic and speak to us, please.
You have never been approached, okay? This is as point of partnership that you have been overlooking is partnership with a funder. You know, I mean, the partnership we're talking about is technical partnership. But what about our rich local partner, and you are interested in producing X product in biotechnology? Would you partner with me because I'm financially okay, or you need always, even for local partners, you need to look for, you know, technical partners as well? Maybe these two aspects should be covered clearly so that you could come out with some fruitful, solid suggestions for partnership.
Well, thank you. Very important points. And they are good for thinking about ways to overcome them and to analyze them. But I will let the panelists comment on this. Anyone?
شكرا لك دكتور على التعليق. What do you mean by local partners? When you say local partners for partnership, what do you have in mind?
Capabilities to partner with you, or businessmen. I mean, would you go ahead and partner with them, or you think you should always insist on partnership with people who are maybe more competent than you technically speaking?
It depends on what you want to achieve, and if you want to get certain technology that is not in Saudi Arabia, I'm not sure if it's available here or not. But if you want, for example, to manufacture a monoclonal antibody, the technology is not here. So you have to go and bring it from outside. Or you can build the capacity through the universities and through academia, and then you should have a product at the end of the day. And regarding your second question, of course you can do that. You have two approaches. The first one is to create your own industry. The second one is to invest financially in the industry outside of Saudi Arabia. So you have the two options, and you are right.
Thank you. Well, the way I look at it, this discussion was arranged for discussion of partnership between biotechnology companies and medical research and development. And this partnership is not exceptional, however, it is unique. It deals with shared interest and shared goals. However, the point you mentioned, why not to make partnership with non-biotechnology industry? Banks, for example, car company, or whoever else. That's a good thought. And those panelists who are experts, probably there are examples in the world. To my understanding, that those non-biotechnology companies, and this is pure opinion, they support, they fund, etc. And this is their role in partnership. But the partnership, the unique one that we are talking about, is utilizing biologic products or products out of biotechnology for medical research and to support each other. However, the point you mentioned is important, and it might come in the recommendation when we list them at the end. Thank you. Dr. Ahmed?
Well, thank you for a nice discussion. And the points I will mention probably already covered in the discussion, but just to highlight a few points of what's been discussed already. Now, we need to differentiate between a funder and a partnership. So you could seek somebody to fund your project, but he doesn't have interest, for example, in mutual investment. That's totally different. And that exists, this model. I mean, you could seek funders from different, not necessarily biotechnology industry and others. And there's the partnership where you want a partnership with, for example, pharma industry. So any company will not show interest unless they would see capacity or capabilities, and that's enable, again, win-win situation for both. So if I am a pharma industry and I need definitely the research labs to develop whatever technology I need, for example, monoclonal antibodies. So if I am industry who is interested in monoclonal antibodies, I would search for research centers or research labs in universities or scientists who already have expertise and build partnership with those like focused areas or entities. So this is how it goes. So you have to, well, there are two things. So what's needed from research centers to attract partnership? And I'm sure it has, a few requirements. One is you need to, show your expertise, your capabilities, what areas you're good at, and again to talk or show yourself to those companies who have the same interest. The same thing for the pharma industry, who needs, is this, okay? So the same thing for the pharma industry,